Hello, and welcome to another interview with the Federal. In conversation with us today is Dr. Ranga Reddy Burri, President of the Infection Control Academy of India, who will be talking to us about whether there is cause to worry or not in light of Maharashtra recording its second ever case of the Zika virus in over a year. Thank you for joining us today, Doctor. From what we know so far, a minor girl from an ashram shala in Maharashtra's Palghar district was diagnosed with the Zika virus on Wednesday. Pune's National Institute of Virology has confirmed the case as well. Just to give the readers some context, the last known case of Zika virus in Maharashtra was recorded in August last year in Pune. So, Doctor, could you start off by telling us what exactly is the Zika virus and are its health implications severe?
Well, Zika virus disease is caused by a virus transmitted primarily by Aedes mosquitoes, which usually bite during the day, right? And usually the symptoms associated with this particular disease are usually mild, like, fever, rash. Sometimes there can be muscle and joint pains. You can have, conjunctivitis, that is the eye infection sometimes, a little bit of malaise and headache. These are generally symptoms which could last something like 3 to 7 days, right? And most people with Zika virus infection do not develop symptoms also, right? It is a small portion among those get infected would have the symptoms I have mentioned. The biggest worry with the Zika virus is that if this infection happens during the pregnancy, it can cause infants to be born with microencephaly. That means they will have a very small head proportionate to their body because of underdevelopment of the brain. So that is the biggest worry we usually have with Zika virus infection, especially among the pregnant ladies. And second worrisome thing about Zika virus is it is usually also associated in some cases with increased risk of neurological complications, right? There is something called as Guillain-Barré syndrome, and sometimes we can have neuropathy and myelitis, etc., etc. That is the cause of worry. And as far as the world scenario is concerned, although it was first detected in chimpanzees in 1947 itself in Uganda, but nothing much of significance happened till about 1970s. When in countries of Africa and also in some of the Asian countries, we started seeing some of these infections are happening and outbreaks are happening. The major outbreak has happened in Micronesia in 2007, and then followed by another one in Polynesia. But the major attention to this problem has come to the fore in 2015, when a large outbreak happened in Brazil, and that has coincided with the FIFA World Cup for football in Brazil in 2015. And naturally, since there was a lot of attention and a lot of press being present during that period in Brazil, it caught the imagination of the people, and also the microencephaly, which has happened in several children who were affected, that has actually put Zika into the headlines of the world. And as far as India is concerned, you're absolutely right that it is a relatively new infection for India, because we see such infections only in last couple of years. In Maharashtra, about a year back, we had one instance probably in August last year. And again, this year, as you rightly mentioned, this little girl got affected with Zika virus. the biggest worry or the concern today is that in a recent study by ICMR and NIV, they have conducted a joint surveillance study somewhere last year, and their findings show that we have a kind of silent spread of Zika virus infection in India. That is a cause of worry.
Why do we say it's a silent spread, doctor? So, just to also understand, in the Indian context, the Zika virus is considered to be an extremely rare disease because I think we clock less than 5,000 cases a year, if anything. Now, in that context, doctor, seeing that it's a relatively new disease, and also the fact that 13 out of 224 of these ashram shala children did develop some sort of feverish symptoms and headache and body ache. Can you talk to us about the transmissibility factor, doctor? Is it only from mosquito to humans, or is it contagious via humans to humans as well?
See, it is a vector-borne disease, and the vector in this case is mosquito. As we already mentioned in the opening lines itself, the mosquito Aedes is the major reason for the transmission. And there are no other routes for the spread of this infection or the transmission. So if we are able to effectively control the mosquito menace, then we will be able to control Zika virus spread in the communities. The biggest thing, I think, I have mentioned about this ICMR NIV study, which has happened last year, that is 2021. They have done prospective, retrospective study where they have found that in several states of India, in the samples what they have taken, they have found Zika virus. Yes, in most cases, probably the disease went without symptoms, and in some cases, probably there would have been very mild symptoms, where the people did not actually even suspect that they had this Zika virus infection. That's why I said it is a silent spread, where the people probably would not be able to even know that they have this infection, and hence probably they would not even do any protective measures in order to not become a transmitter of the infection.
Sure. So, doctor, apart from the symptoms, that you mentioned about headache, body ache, developing slight fever, the symptoms don't sound all that serious. And by your description of the disease, it doesn't sound like, the disease could have any near-death implications except in very special cases. Is this true?
Absolutely right. Other than during the pregnancy, when there is a risk of actually having infant born with microencephaly, and in some rare cases the neurological complications. In most cases it goes either asymptomatic or mildly symptomatic.
Sure. One of my closing questions, doctor, would be that we've in the state of Maharashtra, we've also noticed a steady year-on-year increase in the number of cases of dengue as well. For example, so far in the year, we've already clocked close to 1,300 cases of dengue across the state. Last year, the total number till July stood at 2,300 and something. Now, doctor, given in light of these, is there a correlation between the number of dengue cases and the probability of a Zika virus spreading, since the vector for both of them are mosquitoes?
You are absolutely right in one sense that we had to look at all these things much more holistically. And in the recent years, the number of zoonoses had been rising. Very recently, last week, we have celebrated the World Zoonosis Day. That means the viruses or microorganisms, which are jumping from animals into the humans, they are in rise. And about 75% of the human infections now are considered to be the jumping viruses or the bacteria, etc., from animals. So we need to have a holistic approach in order to contain all these infections becoming outbreaks and then into pandemics and the epidemics and into the pandemics, right? So we need to have a very good surveillance system so that even before they're going to happen, we identify and alert the people to take the measures. For example, in the case of Zika, most of the bites of these mosquitoes, harboring the Zika virus would happen during the daytime. The people have to have a proper protection, having the long sleeves, etc., etc. The same thing goes, in terms of our monsoon seasons. Even before onset of the monsoon season, the government and also the public had to seriously get involved in order to ensure that the breeding of the mosquitoes is either contained or reduced, so that they don't become a menace and they don't become a problem for us in terms of transmission of these infections. So all in all, definitely there is a rise in all these vector-borne and other zoonotic infections. We need to be cautious. We need to have a holistic kind of measures in place. We usually frequently talk about, prepare, prevent, and respond. All these factors had to be happening in a good way in order to ensure that we are not going to see any outbreaks which are going to happen because of these infections, what you have mentioned, and even beyond.
Just one of my last closing questions before that is there any advice that you would like to give readers, because you mentioned that it's pretty much asymptomatic, right? You only feel very light syndromes of if you have contracted the Zika virus. But is there any precautions that we can take if we are sort of feeling under the weather and suspect that it could be a Zika virus that we have contracted? As laymen, is there any sort of self-care that we could do?
Well, even for doctors, it is very difficult to differentiate, especially during the season, because most of these infections, what you have mentioned, either it is dengue or chikungunya or Zika, other viral infections, which happen during this period, they would have, kind of similar symptoms, right? Or they may, go asymptomatic in most cases. So there is no way very specifically we can actually differentiate between them. Only the thing is, if you have a fever or if you have a malaise, etc., etc., get tested, from your nearest hospitals, diagnostic centers, so that you can detect this infection early, so that, you can take a proper medication or the treatment in order to ensure that you are not going to go into any complications.
Sure.
And the biggest precaution at a personal level to be taken is, as I said, it happens because of the mosquito Aedes aegypti, which is usually in tropical and subtropical regions like ours. And usually the bite happens during the day, peaking especially during early morning or the late afternoon. So you have to ensure that, you're not going to have the mosquitoes. You have to have a mosquito control in your surroundings, not only, in your home, but also you have to ensure that in your surroundings, there is no stagnated water where the mosquitoes can breed. If the mosquitoes do actually spread, you have to ensure that, there is going to be a control of them, and, wear full dress in order to ensure that you are not going to get any mosquito bites. So that way you can protect yourself and also your family and your neighbors from transmission of this infection.
Sure. Thanks a lot for joining us today, Doctor, on the Federal interview. It was great to have you on.